Good afternoon and welcome to today's IPSCC webinar, Photo Voice and Walkabout, 2 practical strategies to engage staff and patient and family advisors. My name is Annette Lee and I'm delighted to serve today as your webinar host. Ushma Patel will be moderating today's webinar. To ensure an optimal experience, all lines are muted during the presentation. And now I'll turn it over to Ushma.
Thank you, Annette. Welcome, everyone. I saw by the results of the poll that we have a number of different disciplines joining us, and so we're always happy to see patient and family advisors here. My name is Ushma Patel, and as Annette said, I'm moderating today's presentation. We welcome your questions and comments, so feel free to chat them in during the presentation. We'll make sure that our presenters respond to them at the end of our presentation. For any of you who are not familiar with us, IPSCC was founded in 1992 as a nonprofit organization. Our mission is to provide leadership for advancing patient and family-centered care in all healthcare settings. We provide on-site and off-site consulting and training. We also offer publications, videos, and educational programs. You can visit our website for more information. Now I'd like to briefly introduce our presenters for today's webinar. First, we have Marie Abraham, who is the Vice President for Programming and Publications at IPSCC. Since joining IPSCC in 1996, her work includes providing consultation to hospitals and healthcare systems that are working toward patient and family-centered change and building partnerships with patients and families to improve and redesign healthcare. She also develops written and audiovisual resources, co-authors publications, and serves as lead planner, faculty coordinator, and faculty for IPSCC's conferences, seminars, webinars, and other training efforts. Marie serves as faculty and as a consultant for International Quality Improvement Collaborative, including the Vermont Oxford Network and the International Co-Production Health Network. We also have Amy Nyberg, who's joining us, and she is the mom to 2 former NICU babies. Luke and Jake were born at 24 weeks and spent 120 days in the NICU at Helen DeVos Children's Hospital in Grand Rapids, Michigan. Amy is the March of Dimes NICU Family Support Program Coordinator and a parent advisor at Helen DeVos Children's Hospital in Grand Rapids. She also serves as family faculty in the Newborn Improvement Collaborative for Quality at the Vermont Oxford Network. Please welcome all of our speakers, and with that, I'll turn it over to Marie to get us started.
Thanks, Ushma, and welcome everyone. It's great to have you joining us today. For today, we'll spend our time with a few goals. We want to discuss these 2 methods, Walkabout and Photo Voice. We'll explore the steps, and then we'll take a look at how others have applied them. And we'd like to hear from you, too. So we'd be interested to hear how you might use these techniques in your setting. So these are 2 practical strategies, but there's an important distinction between the 2 of them. So the Walkabout examines systems and processes and practices and environments of healthcare settings through the perspectives of patients and families. So it's really looking at your healthcare setting through their eyes. The other, Photo Voice, that really examines the personal experiences of patients and their families. So it can be used within a healthcare setting, but its value really is seen when patients and families are providing a view of how they manage their own health within their home and community. We're going to spend a little more time today on the Walkabout, and after today's webinar, Annette, in a follow-up email, will send you the instructions so you have them as well. So what's a Walkabout? nice thing about walkabouts are this is a strategy that can be used with advisors, early advisors who have just come on board. It can also be used with experienced advisors. But with new advisors particularly, it gets them partnering and providing their insights pretty early in their tenure. And it's very productive, and people find it beneficial because it identifies ideas for change or improvement from their insights. So it really starts that partnership pretty early on. I'm going to take you through the steps, and then we'll give you some examples so you can see how this gets done. There's the first two steps in the planning stage to prepare for the walkabout. They can be done at the same time or in either order. So you can select a representation of advisors and some staff members and then choose your focus, or you can choose your focus and then select a team that's appropriate to go on the walkabout. Mostly you want to have advisors who are representative of the setting that you're exploring, and staff from the unit or department or clinic who are interested in doing the walkabout. And there's not really a whole lot of prep for the advisors, with the exception of you need to explain the walkabout process to them so that they understand what it is they're being asked to do, and provide the focus. So what is it that you're focusing on in the walkabout? And let them know that their perspectives are really the most important part of this activity, and that's what you're trying to get to. You also want to plan the time. Generally, a walkabout is going to take an hour, but you might be watching some processes, and that might take longer. It can be shorter if you are, doing a walkabout in a small clinic or a small setting. It can also run longer, but generally, plan for about an hour for the actual walkabout. And then you want to have a meeting after that. You might have to have several meetings to discuss the findings, but generally, 2 to 4 hours to do some follow-up discussion and then use those findings to do some action planning. So prior to the walkabout, you want to have some materials gathered, cameras, or phones. I mean, we all take photos on our phones these days. You could use video equipment, although that makes it a little harder to manage in a walkabout. Some way of recording what the observations are going to be. So you could either do that through a phone, do the recorder through your phone, or have someone taking notes, or you can do both. If you are going to be taking any photos of staff or patients and families, you really have to have permissions to do that. You can do walkabouts without taking photos of people, but sometimes in a walkabout there are certain staff or some interactions that they do want to capture. So you need to get permission. So have a photo permission form with you, or several of them, to get that while you're doing the walkabout. Also, if you are thinking of doing a process, for instance, if you're thinking of looking at rounds on an inpatient unit, or you're thinking of doing a shared discussion, a shared decision-making discussion around medication management, for instance, in a clinic, then you might want to create a checklist for yourself to make sure that you are capturing all the process and the observations of the patients and families. It's helpful to have. It's not necessary, but it is helpful to have. And then one thing that people sometimes forget, but it's a really important thing to do, is make sure that you prepare the staff, the patients, and families in the setting where you're going to do the walkabout. So make sure that you've gotten permission from the leadership to do the walkabout, as well as going up to the unit and informing people that there will be a group of people walking through. They will only take photos of people with permission, but they just let them know that this is not a judgment process. This is to gather observations from the perspective of the advisors. And then finally, you want to determine roles. So there has to be someone who is going to capture the recording or capture photos. There is going to have to be somebody who will gather materials. So say if you're in a clinic and there's lots of materials for patients, information or other not healthcare related things, you want somebody who can gather up those materials to bring them back into your meeting. Generally, those roles go to staff so that the patient advisors, patient family advisors, are free to really just express their perspectives and their insights. But if you have experienced advisors, and Amy will give you a great example of this, then they can lead the walkabout. So how do you actually conduct the walkabout? Well, you begin at the point of entry. You begin where the patient and family begin. So determine the best point of entry, and then for some settings that might be more than one point. That's especially true in inpatient settings where people can access a unit or a department or a service in different ways. And then you can shadow a patient or family through a visit. That takes a little more time and preparation. You've got to recruit a patient or family member, get permission. Staff can help you identify a patient who might be coming in for a visit that day or is in the inpatient unit and willing to have a rounds process watched or discharge planning discussion watched. But just explain what you're doing and obviously get your permission. It's really important to tour every area that is visually and physically accessible to patients and families. Sometimes staff tell us that they often just walk by different rooms, even though the doors might be open, that patients and families, they see that, but staff might just, they're just in their work mode and not necessarily seeing all the places that patients and families can see. So then you begin your walkabout. So as I said, you want to gather quote-unquote evidence. Remember that somebody on the team, on the walkabout, is assigned to assist with this. Again, you can take notes or audio record all the observations that advisors are sharing. You really want to make sure that you're encouraging the advisors to provide their insights beyond the actual environment. So if there's a feeling, if there's an experience they want to share, what are they hearing? What are they feeling? And I'm going to talk about this a little bit later, but make sure you're collecting all the materials or you're taking photos of the environment. And that you can ask patient and family advisors, what do you want us to capture in this? So some things to consider when you're doing your walkabout. How are patients and families greeted when they enter? How are the processes of care or the exchange of information done? So how are people communicating in that environment? And you don't have to capture exact words of people. You can just get the observations from the advisors themselves about what it was like for them, what their experiences are, or what they notice when they're there. You want to gather up all the patient and family information and educational materials, so whatever's there for them. make sure you take an example of those, either actually taking the materials or taking pictures of them so you can bring that back. And then look to see your bulletin boards, your posters, your announcements, if you have information kiosks or in hospital television that is on, make sure that you're capturing that as well. And then ask them to speak about what encourages and supports patient participation. So if you're in a clinic, what are the features? And I don't just mean environmental, this could be processes too, but what does encourage patients to participate as a partner in their care? And then what are the features that encourage and support family presence and their participation in their loved one's care? So ask that question during your walkabout. And then, of course, it's very natural that these walkabouts will focus a lot on the physical environment, but as I said, that's not what you want to single out. But look at the signage, the artwork, the color, the lighting. Are there access to views outside for people? So these are the elements that you can consider. Your team can come up with other things that are relevant to the walkabout that you're doing as well. So to summarize the purpose of the walkabout activity, what you really want to capture is the experience of your care setting through the eyes and the perspectives of patients and families. I will say, though, it's also very important, and it really helps to build the collaborative nature of this activity. If you also ask the staff who are on that walkabout with you, if they would be willing to share their own insights about things that are in elements and processes that pose challenges to them and really hinder their ability to partner with patients and families to the level that they really are wanting to do. So while a majority of the time is going to be for the advisors to share their observations, you do want to give staff some time to reflect as you conduct the walkabout and bring those findings back, because that's going to help you in thinking about changes and improvements that you want to occur after the discussion is held. And so for the discussion portion of this, so you want to make sure you bring everybody back into a meeting or two. I always encourage people to not put that too far away from the actual walkabout. You want the experience to be fresh in people's minds. But it does, these walkabouts, if they're done very thoroughly, they usually yield an incredible amount of findings. So you have to really sort through them thoughtfully, and that does take some time. And make sure that you use an approach that really seeks to better understand the results. So use a root cause questioning approach. What did we see, hear, smell, experience? And what do we think is happening? And that might be very different for the staff versus the patients and families, or individuals might have very different ideas of what they think was happening in their observations. And how does it relate to the philosophy of care, the values and missions of the organization itself? So compare what you found. Is this really aligning with what we believe in and what we hold fast to? How does it relate to the core concepts of patient and family-centered care? Is this really collaborative? Is this really partnership? Is this showing respect and dignity? Are we really sharing information in ways that patients and families find useful? Are we encouraging them to share information? So when things stand out to you, and sometimes these are big aha moments particularly for staff, I think, but there might be a material or a particular practice that people say, why do we have that? Or why do we do that? You can ask that about anything, but it often is the things like, yeah, let's revisit that. Is that form really necessary anymore? Or is that process, do we need to do that, or can we do that in a different way? And then you're going to see how the aspects can be improved. So you might come up with a big long list on a board of all the ideas that you've generated that look like they would be potential ideas for change and improvement. And it's going to be too long to be practical for the advisors and the staff to work together to improve. So you have to prioritize the changes and improvements. And you really want to take what you've learned and turn that into some measurable goals for improvement. And so make it very clear, what do we really want to change and improve? You can certainly use the model for improvement. You can do plan, do, study, act cycles around a particular change. But you want that walkabout to be very, very productive and practical and lead to actual change. And then you want to report your efforts. So you can summarize your walkabout and report your efforts to the leadership, the staff in that particular unit, or clinic, and sometimes, when appropriate, the community themselves, because it really showcases how patient and family advisors come together with staff to do some improvement work through their by giving their perspectives and insights. And it's also a great way to recruit more patient and family advisors too. If people see, oh yeah, they really listened and they make changes. So I'm going to take you through just a few snapshots of different walkabouts that I've been able to observe over several years. And then Amy's going to dive deeper into a walkabout that she just conducted. So the first one I want to share with you is a physical rehabilitation outpatient program in a public hospital in an urban setting. And the walkabout actually started outside. This is, though, a picture of getting to the unit. And as you can see, there's two departments in this. There's rehabilitation services, and there's also blood drawing. So people are coming in, and right there, they're seeing the glass doors, and there's rehabilitation, blood drawing, and Department of Ambulatory Care, which that's the broader department, but that the ambulatory care is not something that's easily understandable to a lot of patients and families. So there's one entry for two departments. The patients that were coming in for the outpatient rehab for the very first time were often individuals who had experienced strokes, traumatic brain injuries, other traumatic injuries. So coming into this environment was very confusing for them and very difficult for them to even know where to go. So what you're looking at on one side where you see the lighter desk, that is actually where you check in for the outpatient rehab. And on the right-hand side is where you check in if you are getting blood drawn. And then you see this long hallway with lots of doors that all look the same. And at the very top of the photographs, you can see the signage. Well, the patients and families spoke about if they're in wheelchairs or their brain is still recovering from a very severe injury, then it's very hard to make sense of where they should be, where they need to go, And they also said if they're in a wheelchair, they couldn't see the staff behind the desks. The signage itself is really high and not helpful. And the corridor itself was very long and uninviting, and many of them talked about their experience of coming out and walking the hallways as part of their therapy, and there was nothing to look at. There wasn't anything encouraging or supportive in the environment itself, and also the measurement of how far they were walking was marked on the walls and not on the floor or at a level that would make it inspirational for them to keep walking. However, they did say that once they were in either the exam room or a therapy area, the staff were really welcoming and helpful, respectful, and informative. So they really did feel that the environment was not really reflective of the care that they were receiving there. So they worked with their facilities department in making some cost-effective changes that would really help these patients navigate better. And then this is, I hope you can see this, this is going into a clinic, a primary care clinic in an urban area, and you walk up the stairs. This was the second or third photo I think we took during that walkabout, and this was before you enter into the locked doors of the primary care clinic. And what you saw was this one sign that says, "Attention, absolutely," and then it lists 5 things, no, 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 that they can't do. So that people said, take a picture of that. They also wanted to take a picture of, to the left of this was the security guard. So there was a very imposing message coming at them when they entered this building. Now, security was necessary, but this was intimidating to them. So there was other ways they thought that they could manage security as well as give messages in more positive tones to make people feel like they're coming in and they're respected. In a long-term care center, the residents who were on the walkabout, I'm only sharing one picture from this particular walkabout, asked to take a picture of this nurse, which she allowed permission. And what they said was, this is the nurse who dispenses our meds. And she, look at her face, she's so smiling, she's so pleasant, and she really encourages us every day. So she became part of the walkabout findings. And then this example, well, this was a large walkabout. So this was a group, I was on this walkabout. We actually split into 2 or 3 different teams. I can't remember now. This was a experienced advisor. This was around self-management support in primary care. So we were focused on self-management support as well as in the primary care clinic itself. And she agreed to let us watch her exam. So she's an experienced advisor. That was wonderful for her to do, and we learned a lot by watching the information exchange, just the interaction between the 2 of them, and how they were going about managing her condition. And then all of us gathered back together to do, with another patient advisor, a conversation around goal setting for their condition and their management of it. So it's a little bit artificial, but the doctor who you see in the middle of the photo and the patient, they tried to make it as real as if it was happening in that exam room. So this is one way of us taking a large group who were in the walkabout and allowing us to see a particular process. So it was very helpful. most recently, Northwell Health, which is a very large, actually it's the New York State's largest healthcare provider. They have 14 hospitals, and they're participating in a Better Together project, which is changing the concept of families as visitors in their hospitals. So they actually, each of the hospitals conducted a walkabout. They were particularly looking at signage and the welcoming first impressions. So that's what they focused on. But that's how they started, and it was a great project for all 14 hospitals. And with that, I'm going to turn this over to Amy to do a detailed dive into the walkabout that she conducted at her hospital. Amy?
Thank you, Marie. That was a great overview of a walkabout with some really great questions to consider prior to going on the walkabout. So I think that was really informative. So again, I'm from Helen DeVos Children's Hospital Neonatal Unit. This is just a picture of our front welcome area, as we call it. When families come in to see their babies, they come in to this front desk area. So we did our walkabout a few weeks ago, and this was definitely a family-led exercise. So I prepared the families by giving them the background information that they needed as far as what was the purpose of it, what were we looking for. And we were looking for a family-centered care quality improvement project, and had a great turnout. We had 8 parents attend as well as 6 staff members, so we had 14 people. And, the families really felt empowered to lead this walkabout, and I think in turn that makes them feel invested in making the improvements. So there were 2 scenarios. So we split up into 2 groups. We had one group walk down to the NICU from postpartum or the mother-baby floor as if they had just delivered their baby and were coming down to see their baby for the first time. And the second group came in from the parking garage, so as if they were coming in every day to see their baby. It was interesting. Both scenarios brought up some emotional memories, and, that can lend to really good information, when people are remembering, well, when I came to see my baby the first time, I remember this or I remember that, or I didn't get this information. So we wrote everything down. We had somebody taking notes, as well as we were taking some pictures on our phones. We felt like there were many signage issues, wayfinding, that could be improved upon. And as well as we had some out-of-scope suggestions. So Marie talked about the environmental issues. So we had a group that sort of got stuck on the color of paint on the walls and the color of the flooring. And we really had to just say, you know what, that's out of scope right now because we don't have the budget to make those changes. And that's not quite what we were looking at. We were looking at procedures, policies, other types of projects. So we just had to redirect them. So after we did the walkabout, we planned 2 hours for our walkabout. And after we walked the entire unit, I feel like we did leave some things out. We have a very large unit. We have 108 beds. We're the largest neonatal unit in the state of Michigan. And we did our best in our time frame to walk all of the areas and observe. I felt like we could have done more. But when we were done, the groups came together to discuss our observations. And then what we did is we decided to, at the next meeting, to put together a list of possible projects to take on and discuss. And so that's what we did. We listed them on a big sheet of paper or on a big board, and we then asked the families to rate the projects to be worked on. What are your top 3 projects that you would like to work on and see changed? And then, so they were very good at that. They were very chatty. And so with that, we wanted to get started. Oops, hold on a second. So what everybody seemed to settle on, what really sort of stood out to them, was the pumping room. So this lovely room that we have where moms can go in and they can pump their breast milk. And you can see on the outside of the door there's a sign that says Mother's Lounge. And they really felt like, well, what is that? What does that really mean, Mother's Lounge? Is that like a teacher's lounge where you can go and eat and smoke and away from the students? But so they felt like that was confusing, and if we could change the signage to say maybe Mother's Pumping Lounge, at least it would be more indicative of what that room is really all about. So inside, once you walk in the door, there are 3 areas. I was calling them stalls. That's probably not a good word to use when you're referencing a pumping room. But 3 areas with a curtain and a pump and a sink, and this is just a picture of one of the curtains. But again, it brought up a lot of feelings from the mothers. The moms felt vulnerable in there. They could hear when somebody was coming into the larger room. There's nothing that keeps those curtains from sort of blowing open when the door opens. And one mom said it just felt scary and depressing to be in there. This is an example of a sign that's in one of those individual rooms that says, please remember to wipe down the pump with sanitizing wipes before and after use. But there were no sanitizing wipes in that little area. Those sanitizing wipes were outside in the larger area. So that's more of a just do it, like a just fix it, either get the wipes in there or take the sign down because it's confusing. So this is an example of what the actual room behind the curtain looks like. There are a couple of chairs there with the pump. And as you can see, that blue wall in the background is just empty. It's blank. And the parents said, why can't you put a big bulletin board or a big whiteboard up there with information that the moms can look at while they're pumping, and they can be educated at the same time as they're doing their pumping. So it could be information on the unit, information on how to be successful with pumping. You know, the sky's the limit. And there's so much information to learn when you're thrown into a situation with having a baby in the neonatal unit. So that was another suggestion, something that we're going to work on. And then going back to the curtain, since the moms felt vulnerable, we thought, well, we could just put a hook on the wall and a grommet in that curtain where moms can just hook that curtain, and then they feel, you know, a little bit more protected. So moving back. So that's just a quick overview of how we conducted ours, what we've decided to work on. We haven't gotten any further than that at this time. I do love the questions that Marie posed that you could use, you know, before you start the walkabout. A couple of my colleagues have also come up with some great questions that I wasn't able to get into this presentation in time. But Joanna Salenza from Dartmouth Hitchcock Neonatal Unit and Allison Martin from Betty H. Cameron NICU came up with a great list of questions for the parents that will prompt them. So they'll tour, they'll start with the welcome area or the registration, and the questions are listed, what kind of feelings, does this evoke for you when you walk into this area? They're very well thought out, and I think that's really a great way to prepare parents. I didn't have those questions. I thought, well, we'll just walk through and see what the parents have to say, which actually worked out fine for us. And we came up with more projects than I ever thought we would have. I work in the NICU. I've been there for 13 years, as well as after being a parent there. And I thought, what are we going to find that I walk by every day and I'm not noticing? And like I said, the list was large. So I'm pretty excited about taking on some of these projects that can be led by family. And thank you. That's all I have for now.
Thanks, Amy. So as Amy described her walkabout, this is part of the Vermont Oxford Network Improvement Collaborative. So there are, I can't remember exactly how many NICUs involved in this. I know it's over 50, right, Amy?
Yes.
Yeah. So every unit has been tasked, every center that's part of that collaborative has been tasked with doing a walkabout and having an experienced family partner leading that walkabout, as well as working together to come up with the ideas. So this is huge, and I'm really looking forward to having all the results shared. I think we're going to do that in September, so that's great. Thanks again, Amy. I'm just wondering very quickly, if any of you have ideas of what you might do in your own setting with a walkabout. You can certainly chat them in. Did something spark your interest that you'd like to go back and examine, a process or a particular unit or department? And go ahead and chat it in. It's always fun for us to see what your ideas are. So I do want to go into Photo Voice, and I know we have some questions coming in, so we'll make time for that. So I'm going to go through Photo Voice quickly. There is an excellent resource if this is something that appeals to you for you to access, and I have the URL for that. It's a free resource. That's just a wonderful toolbox for doing Photo Voice. But, why Photo Voice? So photos and pictures, videos even, they're compelling, and they ignite and inspire change. I think through photos, especially doing the Photo Voice project, it allows us to take a look at the real lives of people and how they manage their health, how they experience a condition, how they might practice healthy behaviors within their own life, how it works in their home, in their work, in their community. So it's getting outside the four walls of a healthcare setting and seeing what is it like to live with a condition or with a new diagnosis or some other healthcare issue. And a lot of times this Photo Voice is used in public policy and advocacy initiatives, but I really like the application to healthcare. So for preparing for the Photo Voice, you do a similar thing. You get a broad representation of advisors, and then you include staff. If you're a community organization or this is going to have some meaning or the results may have some impact on the community, then you can invite a few community members as you see appropriate. And you choose the theme and the goals and be pretty specific about it. Because this is getting into people's personal lives, you really have to be very clear about the privacy issues. So if they're going to take photos of family members or people they know, you really have to provide consent forms. You also have to be very explicit about who's going to own these photos? So while people are taking the photos, the ownership is really part of this larger collective, and it, it may go into an exhibit or a presentation or some educational forum. So you just want to make sure that the people understand that these photos will be shared in some fashion. So think about if people need equipment. Not everybody has a smartphone, so not everybody can take pictures on phones. So provide equipment as necessary. You can also train the people who are going to participate on some basic photography skills. It's not necessary, but if you are thinking of doing some kind of more formal presentation or exhibit with these photos, then it is helpful to just get some, really, really basic skills on how to take a good photograph. And then you just obviously have to decide on the time frame. How long are you asking them to capture their experience for? Are you giving them a week? Is it a day in the life? Is it a month? Just determine that time frame in partnership with them, what makes sense to them, and also the follow-up meetings. The follow-up meetings can take a little bit longer than the walkabout meetings, and you'll see why in a minute. Identify a key contact for them to get in touch with if they have any questions as they're out there taking their photos, or they encounter any problems. And ask them and provide some way of them to journal what they are capturing. So whatever situations or events or their reflections of why they took a particular photo. That's really helpful when you come back. If it's a little bit longer time, then they can go back to their own journal and say, oh, that's right, I took this picture because of this. So you set them out and give them an assignment to take photos of, that reflect the theme that you all have selected. And then they're going to come back into a first meeting and share all of their photos with the group. So you might want to ask the advisors to put all their photos, pin all their photos up onto a wall so that everybody can walk around and people can explain the different photos. You're going to have a lot of them. That's why this meeting takes a long time. But you want to get them to be able to articulate and express why they took those photos. And then as they're talking about them, you're going to say, consider the theme. How does this align or reflect something from the theme? And then at the end of this meeting, you might ask them at this point, select a few photos that really say something to you about the theme from your perspective. Take a few photos that express what you are trying to say or what you thought you captured. And those are the photos that, just a few photos, so they're manageable. Those are the photos that will go into the presentation. This is a journey through their real personal experiences. So sometimes, and Amy talked about this a little bit, there's some uncomfortable feelings that get brought up by these reflections of their lives, living with a condition or having a certain diagnosis or whatever it may be that you're exploring. So make sure that there's somebody available after the meeting to talk to anyone who needs a debrief and some support and encouragement. So after they share their photos and they are looking at the photos that they've selected, you can start asking questions about that particular photo or that set of photos. So again, you want to say, what's happening? Why'd you take a picture of it? And what does that image say about life in our community or life with your particular diagnosis or life trying to have increase your healthy behaviors? And then how can that photo educate others? So what's the message? And what is it that we can take away from that photo to understand what we can improve if something needs to be improved, or what can be changed. And then you'll write captions or short descriptions. That's often the second meeting because that does take a little while. So people can write a caption. They can record what the photo means to them. They can write up a script for a presentation so that they are prepared to present their photos to a group. And then think about what are you going to do with these photos? So are you going to plan an exhibit or a presentation? Are these photos going to be put in, say, the lobby or used at a nursing skill fair or put up in a registration and waiting area in a clinic? How is it going to be presented? Is there going to be a formal presentation? Are you going to use these photos to plan for change? And then I think for both the photo voice and the walkabout, it's important to evaluate, how is this process? How did it make a difference? Did we make an impact? And then for anybody who was part of the process, make sure that even if the impact comes down the road, make sure that they understand what the impact was. So very quickly, I'll just give you a few resources to look up the photo voice. This is a wonderful photographer in the New York area. Her name is Annie Levy. She's established the PhotoIDFoundation.org, and she works with a lot of healthcare systems. This particular project that she did was called Not Defined by Diagnosis. These were teens at Montefiore who had life-threatening illnesses. And they came up with this title after their meetings as they looked at their photos. In another project in a town near me in Connecticut, New Britain, they were looking at obesity prevention in the adolescent and in the Hispanic population specifically. So they received funding from the Robert Wood Johnson Foundation to actually do this and prepare the teens to do a photo voice project. And they found many things in both the school environment, the home environment, and the neighborhoods that really impacted the teens' ability to have healthy behaviors. And they did present. They presented a number of times, but one of their presentations was to the town council to ask for changes in the school system to help them support their access to appropriate PE and access neighborhood areas where they could safely exercise. And they actually did make quite an impact, I have to say. And they all developed very good leadership skills through doing this. And then this is, the next two slides are just some two organizations that you can get really good resources to do photo voice yourself. So this one is in the UK, photovoice.org, excuse me, and there's lots of wonderful examples and ways to do it. But the resource that I really want to share with you is this community toolbox. It's part of a larger toolbox of with lots of wonderful resources for all different activities, but this particular chapter is very, very detailed on how to do photo voice. I will say that I was just in South Carolina, a few months ago, and they used photo voice with patients with diabetes. They had a group of 20 or so patients in two different groups that used the photo voice, and they were asked to take pictures of how they managed their diabetes in their home environment and in their community environment. And then they brought those pictures back. And those pictures were one activity that they used, and were working with researchers to develop research questions for looking at both preventing diabetes as well as managing diabetes. It was really powerful to see them using this in that way and in research. So we have a few minutes for questions, and I know we have a question chatted in, but I'm also wondering if anyone has an idea of a project that you would use either photo voice or the walkabout in. But I'll open it up to questions. Ushma?
Thanks, Marie. That was a wonderful overview of walkabouts and photo voice, and thank you to Amy as well. So we have one question so far from Becky Haynes. She asked, how do clinicians feel about being observed by patients during the walkabout? Do you encourage engagement with staff during the walkabout? So
Yeah,
Marie, would you like to take this one? And then
sure,
maybe you have thoughts as well?
Yeah, I will, and then I'd like to hear Amy's thoughts since she just did this very recently. So I think this is one of the reasons why it's so important to prepare the staff that are in the unit or the department or the clinic that you are doing the walkabout, and make sure that they understand this is not about judgment at all. This is purely observation, and they should just go about their normal day. If people have, and this is why it's important to meet with the staff beforehand, so don't wait till the day of. But if you know that you're going to be in their unit doing this, and you have permission from the leadership to do it, make sure that you could meet them during staff break, or talk to people and tell them what you're doing and what the purpose of that is. And you can also invite them to participate in the post meeting that looks at the results and comes up with ideas for change. So it has to be understood that this isn't about judgment or finding negative things. It's about looking at things through the perspective of the patients and families, those things that even Amy said she walks by every day and doesn't notice. And to the second question, I typically don't engage the staff. The walkabout team doesn't, because the walkabout is seeing through their eyes and seeing their perspectives. And it's almost like you're breaking the wall if you engage with them during the walkabout. But I'd be interested to hear, that's my opinion, but I'd like to hear what Amy has to say about that.
Thanks, Marie. I completely agree with everything that you said. As far as how do clinicians feel about being observed, we have been we've been pretty entrenched in patient and family-centered care for several years. The clinicians are very aware of our Family Advisory Council. They come and they participate in that, so they sort of understand the work that we do as a group. With that said, I will say that we had a couple of clinicians on our walkabout. We had a neonatologist, a physician, as well as a neonatal nurse practitioner who participated in the walkout. So they actually got to see
I think we just lost Amy again. She might
know. Hopefully she'll be able to join back.
Well, I hope that answered your question, Becky. If not, please email us and we can continue, or we'll get Amy to email us what her closing thought was. I want to hand it back to Ushma, and I want to thank everybody for joining us today.
Sure. So we don't have any other questions, but I do have actually one question for you, Marie. You mentioned having an observational checklist in the beginning for the walkabout. Do you know of any examples that folks can draw upon for this? Are there existing tools that are out there that people can use? for their walkabout?
Yeah, we had a one for rounds, bedside rounds, that we had to cut it down a little bit, and then we have how to do a walkabout on self-management that included things to the steps to look for. So if anybody's interested in the self-management, I'd be happy to share that too. Oh, and Amy's back, but I know we're over time, Annette, so I don't want to
sorry
be
about that.
respectful. Hey. Yes, no problem, Amy. Did you want to finish your thought?
No, I think I pretty much covered it. I mean, the clinicians participated with us, so there was no issue. And I think everybody has a copy of the slides. I think it really gives a good blueprint for a walkabout and what kinds of questions to ask. So
yeah,
that was great, Marie.
I think that point it needs to be emphasized so that if staff know that staff from their own unit they're going to be on that unit and also providing some of their reflections, it does help to assuage any of the fear or caution. Okay, now I am going to hand it over to Annette.
All right, thank you, Marie, and thank you, Amy, for that great presentation. So our online learning community, PSCC Connect, of course, you can go on there if you kind of want to talk to other people, see if they may have any thoughts or experience on this or any other topic that you might think of related to patient and family-centered care. It's free to join, and you can just join at the link, the website that you see on the screen. So registration is now open for our upcoming seminar, Moving Forward with Patient and Family-Centered Care, Partnerships for Quality and Safety, which will be taking place on June 13th through 14th in Detroit, Michigan. So you can go ahead on our website and register today and learn more about it. And then we'll update you on the website as more information comes up. So we hope you'll join us for another webinar coming soon. Here are our two webinars that we're having for the next 2 months. The May webinar the date may change, but the two topics will be the same. So also go back to our website and see when registration is coming soon. Thank you so much for joining us today. Within the next few days, I'll be sending you a certificate of participation and a link to access a recording of the webinar. A very short survey will appear after this meeting ends. Please take a few minutes to share your thoughts with us, as it helps us improve the content of our webinars. Lastly, please feel free to contact us at IPFCC if we can further assist you in your patient and family-centered endeavors. Thank you for your participation and have a great afternoon.